Patients' safety and well-being have always been at the center of our mission at the St. Lawrence Health System Clinical Research Department. So developing a defined patient-centered outcomes research program was a necessary next step. To keep it simple, without patient volunteers, there is no research. And without research, there are no new medications and no new knowledge of our communities. By seeking the input and bringing the voice of patients, caregivers, and the community into our research processes, we're making sure that the results of our research are as meaningful as possible to the North Country.
At St. Lawrence Health System, we are committed to putting patients first. We are making strides toward ensuring that everything we do from a research perspective has the patient at the core. That makes sure that we're addressing access for patients, make sure the studies that we're spending our time and resources on are in line with our community and disease states across our region, to ensure that we're having a relevant approach every trial, every day, every initiative that we're working on, that it translates to the patient and the family and the community that we're working for.
Patient-centered outcomes research was a new concept for me that I was introduced to about a year ago when I had the opportunity to work with the clinical research department. And it was quite an exciting concept because it validated everything that I had come to believe in my heart over the past 40 years of being a nurse. And that's how important patients are, the concept of being patient-centered. As a longtime resident of the North Country, I chose to live here and I've chose to practice here. And the community around me is very, very important. The needs of the North Country are unique, as are most places, but in rural New York, there's other barriers like distance, access, and our involvement with this project is going to help close some of those gaps. It's very exciting to think that my small team is going to be able to introduce this topic to community members who are then going to start having those conversations about what they need and helping inform the processes that are going to help meet those needs.
So patient-centered outcomes research, it's about bridging the gap between the community and research goals. It's about partnering with doctors and nurses, healthcare workers, but most importantly, our patients. It's more important now than ever before to have representation from every aspect and member of the community in order to guide the future of healthcare in the North Country. When I sit down with patients, I try to have a conversation and connection about their values and goals in order to paint the larger picture that is the research process.
Patient-centered care is treating every patient the way we would want to be treated, the way we would want our family treated. As a nurse, my job is to provide them with the data that they need to lay it out and figure out how this affects their life and how they want to proceed, how it will affect their family's life. So we empower patients to become active members of their own healthcare team. That's patient-centered care. Research is so important. There's not a medication out there that you or your family take that hasn't gone through the same steps that we're doing right here in rural New York. I have been the beneficiary of medical research with a medication that saved my life. I just feel like it's a great thing to do research and to benefit from it and for others to benefit too. It's a legacy.
Patient-centered outcomes research is research that is driven by patients and which answers the questions that are most important to patients. The reason that doing patient-centered outcomes research in the North Country, in my opinion, is so important is that rural areas like ours have traditionally been underrepresented in research studies. And it's really important not just to have patients asking the questions that are most important to them, but to have rural patients asking the questions that are most important to them so that we can help develop patient-centered outcomes research, not just for our area, but for all rural areas going forward.
Patient-centered outcomes research is important to me because I believe it to be a significant part of St. Lawrence Health System's continuing efforts to improve the quality of health care here in the North Country. By providing patients with additional information about their health care, information generated from their collaboration with healthcare providers in research efforts, we will be gaining invaluable data to help us achieve that goal, the goal of improving healthcare here in the North Country.
Our role is to empower patients and respect them as intelligent individuals, to treat them with dignity, allowing them to become independent and respect their privacy and their choices. I think that's how I would want to be treated.